Hi, my name is Tamara Johnson. I'm going to be giving a presentation on the hepatitis B vaccine. I attend the University of Texas at Arlington. I'm pursuing my master's in nursing education. Okay, so for starters, the hepatitis B vaccine. Who, what, and when? So our learning environment. So my plan is to be educating our NICU nurses, our transition nurses, as well as our couplet nurses about the hepatitis B vaccine. It's a vaccine that is given daily at our hospital whenever babies are born, and we're going to find out why we give it. All of these nurses have a minimum of an associate's degree, and many of them also have their certifications either in mother-baby, low-risk nursery, or a high-risk nursery. All right, so our content standards. So according to the professional standards when working with newborns, it is the responsibility of the nurse to know our policies and our procedures for our unit, as well as common illnesses and then treatments that go along with those illnesses. The focus of this course is the administration of the hepatitis B vaccine and the importance of us giving it. And that's our responsibility to know why we're giving it and who it should be given to. And with this information is how we can educate our families. So our objectives. After the completion of this class, the nurses will be able to explain to new parents the importance of their newborn in receiving the hepatitis B vaccine, explain what not having the newborn vaccinated could lead to, be able to tell what is important about the timing of the administration of the hepatitis B vaccine. You'll also be able to have the ability to join a team for us to be able to create some kind of educational material for moms prenatally, because they need to have this information before they come in and deliver. And we also need to know the criteria needed to justify the need for hepatitis B, and then also the HBIG, so the hepatitis immunoglobulin. So prevention is key. What are we preventing with the hepatitis B vaccine? So now is when I'm going to hand out our quiz. And then we're going to go over this quiz at the end. So the purpose of the quiz is to see what do you know about the hepatitis B vaccine before we even start. So this is something that hopefully y'all do know all the answers to this. And if you don't, that's definitely going to be the purpose of this course. So what are we preventing? We are preventing hepatocellular carcinoma and liver cirrhosis. So by giving a baby a hepatitis B vaccine, by starting the process, we are preventing cirrhosis and we are preventing cancer. It is not just an illness that will come and go. It is something that will be a chronic illness that a baby will have to grow into an adult and deal with. So cancer and cirrhosis, both very ugly. So the hepatitis B vaccine. So the vaccine itself is 75 to 95% effective when given perinatally, so after the baby is born, in preventing that transmission whenever that first dose is given within the first 24 hours. So for it to be completely covered, for it to be at that 95% and some even greater, the moms need to understand that their baby not only needs to receive this first dose of hepatitis B vaccine, but they also need to receive the entire course. And so you get it at birth, you give it at 2 months, and then you also get it at 6 months. And after that, that's whenever you are completely immunized and prevented from getting the hepatitis B virus. So it's only after the completion of this series that you see the transmission rate from perinatally go down to 0.7% to 1.1%. So those moms who are in fact infected with the hepatitis B vaccine, if their babies completely go through and get the 3-course treatment, starting with their birth treatment, their risk of getting or contracting the hepatitis B vaccine is 0.7%. So from this evidence, this is what formed the reasoning to change the practice and advise administration to happen by 24 hours of life. We used to could either recommend or go along with the family, because we're all about keeping the families happy. If the mom felt like she wanted to wait and have her baby immunized at her pediatrician's office because she just thought it was too much to happen in the hospital, then we would definitely back her up and say that is not a problem. You can do as you wish, you know, and we would just write refused on the vaccine consent form at our hospital. This is no longer the case. It is no longer recommended that babies are discharged home without receiving that first dose of the hepatitis B vaccine. So the reason is adults around the baby, caring for the baby, other family members, they can be infected. They can be, in fact, have the virus and not realize that they have the virus, and can end up giving it to the baby. Not just touching, absolutely not. Kissing, not really, but do they have a sore on their mouth and don't realize it? Did they chew some food and then offered the baby, probably not a newborn, but I mean a couple-month-old baby, offer the baby some food out of their mouth, not realizing that they had this illness? That's how it ends up being transmitted. The hepatitis B vaccine is very well tolerated by newborns. Side effects are pain at site, which anytime you get a vaccine, you're going to be a little bit sore. Anytime you get any kind of shot, whether it be vaccine or antibiotic, you're going to be a little bit sore. You can have some redness. There may be some swelling. There may be some low-grade fever. And then some older children, adults, have reported some kind of headaches. But is that stress-induced? I don't know. I know it's stressful sometimes just getting vaccines. So what are the exact recommendations? So the Centers for Disease Control, along with the Prevention's Advisory Committee, immunization practices. So this is the committee that this is their full job, is to decide what immunizations are needed, when are they needed, who is at high risk, when should it be given. These committees, along with the CDC, they are basically the top dogs in knowing everything there is to know about vaccines. So what they've said about the hepatitis B vaccine is that all infants greater than 2,000 grams should receive the hepatitis B vaccine prior to 24 hours of life. They go on to say that all infants less than 2,000 grams, so they're really, really little, probably really premature, they should receive the hepatitis B vaccine at 1 month of life or prior to discharge, whichever comes first. So this is actually from the AAP. This gives us a nice picture. It seems clear, but I'm sure people could come up with questions on what babies should be vaccinated, when should the babies be vaccinated, and what labs should you need. So it talks about our mothers that are hepatitis positive. So that's from prenatally, we're going to know that. For hepatitis negative, we're going to know that prenatally, and then unknown. So did this woman come into your unit with no prenatal care, and you have no prenatals? Did she come in with prenatal care, but you just don't have her prenatals whenever the baby's born? Did she precipitously deliver the baby before prenatals could be brought to the unit? So this is a guideline. Did you know this guideline existed? So let's talk about our hepatitis negative moms. So for our premature infants weighing less than 2,000 grams at birth, the hepatitis B vaccine, it's not given immediately. You're going to give it either at 1 month of age or prior to discharge. So this is specifically for the NICU nurses. So you need to know your little babies and when it should be given. For the term babies, so greater than 2,000 grams at birth, we're reiterating the hepatitis B vaccine should be given before 24 hours of life. And remember, this is recommendations from the CDC and then from that advisory council. Many recommend that the hepatitis B vaccine be given at 12 hours of life, and we're going to talk about why that is in just a little bit. So our hepatitis positive mamas, so the ones with prenatal care and we know they're positive, or maybe they were able to get mom's labs from the time she was admitted to the hospital, from the time she delivered, and she came up positive. So all newborns, regardless of weight, so whether you are 1,800 grams or 4,500 grams, if you are born to a mother that is hepatitis positive, these babies will receive a hepatitis B vaccine and also the HBIG, so the hepatitis immunoglobulin vaccine. Just a kind of a reminder, but just information, this is something new that I learned, that these vaccines should be given in different legs. So you know, just growing up, babies in general, they get multiple vaccines. Some can be given in the same legs. It's recommended that the hepatitis B vaccine be given in one thigh and then the HBIG be given in another thigh. So for these babies that are less than 2,000 grams and they are receiving this dose whenever they are really tiny, that is actually not considered their first dose. They will receive their first dose at 1 month of age or prior to discharge, and then their course is completed. And the rationale behind that is because they are so tiny, and just the amount of fat that they have on their body and the way that they are able to metabolize that vaccine, they need it again because their body is not able to sustain the hepatitis coverage from that initial, but that will get them to older, and then they can start the series again. So the hepatitis unknown. So these are the mamas, no prenatal care, came in, delivered fast. So you give the hepatitis B vaccine by 12 hours of life regardless of weight, because the whole purpose of us giving the hepatitis B vaccine is to protect our babies. So if we don't know what mom's status is, that baby needs to be immunized with the hepatitis B vaccine by 12 hours of life. Because if the mom turns up positive, then we've done an injustice to the baby and not protecting the baby. You should also give the HBIG at 12 hours of life if you still don't have mom's results. You don't want to wait days before you get results. If the hepatitis status is still unknown, it is safer to go ahead and protect your baby and then find out that mom was negative than to find out mom is positive and your baby has not been treated. So on this, some hospitals have changed their practice because they felt like this is the best care for their babies. And what they've done is their goal is for every baby to receive the hepatitis B vaccine by 12 hours of life. And they've found this just takes out those few babies that could be born to a positive mom, or if they're unknown and they turn positive. This is just the best way to make sure that those babies are protected. Another note on this, whenever you're reviewing mothers' prenatals, I know I've reviewed hundreds, maybe even thousands, before a baby's born. And usually the labs that we look at, they've been transcribed. So they've been moved over there by somebody else in the office, you know, somebody medical, not meaning to make errors, but we are all human. And so it is actually recommended through the CDC and also the committee that whenever you are looking at a mom's hepatitis status specifically, you should see the results printed from the lab, not just what's been transcribed into mom's prenatals. And the results from the hepatitis from the lab should be in mom's chart, but then also put into baby's chart, just so that we can make sure that we have all the information possible. So making this full circle, so linking this back to our objective. With the completion of this course, we have learned what the hepatitis B vaccine can prevent and the importance for babies being vaccinated before 24 hours of life. We have learned the importance of having the mother's correct hepatitis results. And remember, the correct result is the one that comes straight from the lab, not what's been transcribed. And we also have the knowledge to build educational material for these moms to see before they come in and they've got a baby in their arms and we're asking them to sign a consent. They should hear this from their OB-GYN, from a pediatrician that maybe they have established from other children. We should all be instructing them with all this information. And we also know which babies need to receive the hepatitis B vaccine and the HBIG vaccine to help prevent the hepatocellular carcinoma and also the liver cirrhosis. These are, this is a virus that will last in them their entire life. So we're just going to review the quiz. So how do you explain to parents the rationale for immunizing their newborn with the hepatitis B vaccine? So it's no longer going to be, it's recommended that we go ahead and vaccinate your baby before they go home. We now have the information to explain why, the importance of, the risk of somebody that may not even know transmitting it to their baby. The timing of the first hepatitis B vaccine does not matter as long as it's given prior to discharge. We now know that that is false. Timing is everything whenever it comes to the hepatitis B vaccine. When reviewing prenatals, there is no need to see the actual lab results. Reviewing what has been transcribed at the doctor's office is sufficient when planning treatment. This is false. Again, many of you probably said true, just thinking you've got mom's prenatals, let's go by the prenatals. You need to actually have the lab result in your hand from the lab. And then finally, everyone that is infected with the hepatitis B virus knows they have the virus. This is false. There are many adults who do not know they have the virus because I don't know an adult that would infect a baby or infect anybody knowingly. So thank you for attending this lecture, Here are the references that I got all my material from. Thank you.